Good morning, everyone. Welcome to this conversation on how we won progressive policies in red states in the middle of COVID. I'm Jonathan Schleifer, Executive Director of the Fairness Project. For those unfamiliar with us, we were founded in 2016 with a simple theory of change, which is that even as we improve our democracy and elect the people who will do the right things by working people and working families, that we couldn't ask them to wait for higher wages, for better health care, for paid leave or for family leave to protect them from predatory lenders. And so the Fairness Project goes around that political system, goes around the ideologues, goes around the partisanship, and places ballot initiatives, places the issues in front of voters and asks them directly to weigh in on the questions that matter to them most. Do they want to raise wages for themselves and their neighbors? Do they want to provide health care to those who need it most? Do they want their essential workers to have paid family leave and paid leave? And so we've been doing this since 2016, and we have won 18 out of 19 campaigns, expanding healthcare, increasing wages, fighting against predatory lenders, and getting people access to paid sick leave. As a result of these wins, we've changed the lives of 15 million Americans. And one of the things that has truly stood out on our end is our ability to take policies that conventional wisdoms and pundits would say would never fly in purple states, let alone red states, and win. And that's what we want to talk about today, because this summer we have won healthcare, we've expanded Medicaid, we've expanded one of the key tenets of Obamacare for over 430,000 people in 2 deep red states, sending the strongest message about the importance of healthcare in this election, that voters want more healthcare and not less. And in doing so, and this was in Oklahoma, in structuring the initiative way we did, we were even able to put a stop to Trump's block grant Medicaid program. Now, Oklahoma and Missouri are now the only states in the nation to make Medicaid expansion a right by placing Medicaid expansion in their constitutions. These are 2 states that Trump won by double digits, even as he is pursuing to sue to take away healthcare from 20 million people, to undermine the ACA in the courts. In Missouri and Oklahoma, they put Medicaid expansion in their constitution. Now, when we began this work, taking these issues directly to the ballot, there was an untested strategy, and many were skeptical at first. But the way we ensure these wins is by running campaigns like gubernatorial or Senate races. We have modeling, research, a diverse coalition. These are the keys to winning. Building a long runway, starting 2, 3, 4 years out to make sure that the coalitions are in place, the energy is there, voters are communicated with from the very beginning. Now, I think one of the things that's most exciting about this work is that we have found, and it's going to sound naive, but I think we've proven it through our work winning ballot initiatives on progressive policies in red and purple states. I think what we found is that Americans are in much more agreement and are much more generous than our politicians or social media would suggest. We've now seen in Maine, Utah, Idaho, Nebraska, Oklahoma, states Trump won by a large margin, that those same voters have passed Medicaid expansion, have raised the minimum wage, which is why I'm excited today to sort of break down how it is done, to challenge some of the conventional wisdom about what can be done in red states, about how you build sustainable power in those states, with some people who have been doing it and who did it just this past summer with us. So we're here today, and I'm thrilled to have Amy Levin, Amber England, Genevieve Williams, and Jocelyn Strauss with us to discuss in more detail how they did it, and to share some of the lessons learned as we head into November, and as we once again face a concurrent healthcare and economic crisis that is on voters' minds. So first I want to start with Amy Levin. Amy is our pollster. She's our strategist. She's been our friend. She's provided comfort in dark times. Amy has polled across all of our ballot initiatives on Medicaid expansion, all the winning ones on Medicaid expansion, as well as our minimum wage work in Missouri and Arkansas. Amy's with the Benenson Strategy Group, and she's actually built a new project out of Benenson, Breakthrough Campaigns, that's really pushing the envelope and thinking about doing electoral work, both for candidates, for ballot initiatives. So Amy, welcome. Thank you for getting up. I know you're like many on a West Coast schedule, so I hope you have a cup of coffee. And I just want to jump right into the polling work, because really what you have done for us is help to tell us whether it's possible to win or not, because every time the Fairness Project goes into a state, the first question we have beyond, is there a coalition of support, is this possible? Do voters want it? And so Amy has both helped us answer that question over and over again. Is it viable? Do voters support this policy? And she's also helped us then map a path to winning afterwards. So Amy, as you look across the last 4 years, what have you learned about polling in red states and in communicating with red state voters? And Amy, you're on mute.
How's that? I think one of the first things we had to do on a number of fronts was really just challenge our assumptions about Medicaid, about red state voters, about attitudes, about even what, there used to be this assumption that you have to start at 60% on a ballot to be able to win. And I think one of the things these Medicaid ballots have shown us is we really need to challenge a lot of those assumptions. With red state voters, I hear a lot from candidates, from advocates, this perception that Medicaid is unpopular, that it's perceived as this welfare program, that Republicans don't support it, and that's just not true. It tests very well. It has strong favorability. People do value the idea of giving health care to struggling families, to people. We always knew that the support for expanding Medicaid in these states was even higher than the ballot, because the ballot, it has complicated language. It has, in some cases, it has dollar figures attached. But we certainly found out early and often that Medicaid is a popular program. I think, there's also this perception that expanding any government program, and certainly anything to do with Obamacare, was, a sort of non-starter in red states. And we saw throughout that, we always test negatives, we always test attacks. What do we think they are going to say about us? And it was always one of the weakest negatives, the idea that, this is putting Obamacare into the Constitution. And that was even, in some of the states before you started to see the popularity of the ACA rise. So I think that was another big assumption to challenge. And then, the idea that Republicans and red state voters don't support the expansion of healthcare. When Governor Parson in Missouri, he switched us sort of at the last minute from running on a November ballot to running in August. One of the things we saw, we went into the field and we polled both a November electorate and an August electorate right before, when we weren't quite sure if it was going to happen. And what we saw, with a smaller electorate, with a more tuned in electorate, even though it was redder, we didn't see a big difference in strategy. It just told us that he was worried about Fairness Project turning people out in November against him.
Sorry, I was on mute. Amy, thank you. I guess the next question is sort of like, how do you map the course to winning in states where, if you just divide the states between D's and R's, right, between Democrats and Republicans vastly outnumber outnumber Democrats. And so if you were to sort of align policies with party, we would have lost all of these campaigns. And so how do you think about polling and developing a strategy in conditions like that, again, conventional wisdom would say would be impossible to win?
Yep. I mean, I think you start, what I said earlier about challenging that conventional wisdom. But look, in a lot of states, we hear all this debate right now about, is it more about exciting the base or persuading the middle? And in a lot of these states, we didn't have that luxury at all. We had, can you persuade the right and hold the middle? And so what we did from the beginning was we looked at the viability, we call it. And Jonathan, you mentioned this, but is this even possible? And I think we were always very pleasantly surprised to see it was possible. And, in a lot of places, just because, Democrats were completely consolidated, or they could be completely consolidated, but that's not why we won in most of these places. We won because in rural areas, we didn't, in some states, we actually won the rural areas. And in others, it's just about, not doing so, not bleeding out with them. In rural areas with Republicans, older voters were often among our biggest supporters of this. Particularly 50 to 64-year-olds who are very economically anxious themselves. So in a lot of these states, it was really about, again, challenging our assumptions about who we can get and how and sort of how to talk to them. And then in other states, especially like Missouri, our most recent one, it really was about finding that intersection of, what is going to motivate our base, particularly when we needed to turn them out in August during a pandemic, while also moving the center and the center right, and using polling to figure out what is the message as a whole, and what do you sort of say in targeted communications over on the right, what do you say in targeted communications on the left? But I think another assumption that we found is there was a great deal of messaging that works across the spectrum.
Great, thank you. I think now's a good time to actually bring in Amber England, who is the campaign manager for the Yes on 802 campaign, which is a campaign that expanded Medicaid in Oklahoma. Amber has almost 2 decades of political communication, policy, grassroots organizing experience. For those of us who are following the teacher organizing in Oklahoma, that Amber was behind that. Truly inspiring career in politics and change, more importantly. And so Amber, and most recently, Amber led the work to expand Medicaid in Oklahoma, a state that Trump won with 65% of the vote. But literally just 51 days ago, Oklahomans voted to expand Medicaid, put it in the state constitution, against impossible odds on an election date that was engineered to be as hard as possible for Amber and her team and Oklahoma to win. So Amber, I'm just going to put the question to you. How did you win a progressive campaign in a deep red state?
Well, first of all, Jonathan, thank you for asking me to be a part of this conversation this morning. I think it is really important that we tell the Oklahoma story and what happened on June 30th, and to challenge those assumptions that you can't win a progressive issue in a deep red state. I wouldn't call this a progressive issue. I would call this an American issue or an Oklahoma issue. Everyone believes that folks need access to healthcare. And so we started this campaign with the assumption that every Oklahoman was worthy of having that conversation. And we didn't just completely just brush off voters based on geography or party or demographic. We said, look at all 77 counties, and we've got to go we have to go have conversations with every voter in Oklahoma in every corner of the state in all 77 counties. And that's what we did. We had over 150 events in the year and a half that we were running this campaign. Specifically on the get out the vote effort, I think we knocked on, I think it was like 65,000 doors in the last week of the campaign. But what happened was we built the base from the beginning, and the assumption that every Oklahoma voter was willing to have a conversation with us about healthcare.
Before I ask Amber my next question, just for those who do have questions of any of the panelists, please start to throw them into the Q&A. And we'll have a section at the end where I'll be able to pose those questions to Amy, to Genevieve, to Amber, to Jocelyn. So please have those questions coming in throughout, and we'll be sure to get to them at the end. To Amber, I need to apologize because I committed the sin myself of calling them progressive policies and putting labels on, unnecessarily putting a label on a policy which is just about giving healthcare to people who need it most. And so forgive me for that.
It's okay, like trained Oklahoman to talk about issues from a very clean slate.
Yeah, so let's talk about how you do that when everyone is so primed to think in terms of party, whether they're wearing a MAGA hat or they're wearing a Clinton t-shirt a couple of years ago or a Biden t-shirt today. How do you get people to think about issues and not as proxies for party or identity or tribalism? I mean, how do you sort of break through all that?
I think it's important, again, to go back to that, just the premise that every Oklahoma voter deserves the opportunity to be engaged in conversation. And so just going in with that attitude first. But also that's why I really love ballot measures and initiative petition work, because you do get to have conversations about issues. And when you can take the conversation away from partisan politics and bring it to an issue, you can connect with voters. And oftentimes that's, it sounds cliche, but it's through stories, right? It's like, does your mom or dad, or do you know someone in your family who needs access to healthcare? And you try to make a connection with the voter's heart, right? Because that's really what is, at the crux of this issue is, I think about my niece who is in her 20s working 2 jobs, both that don't offer health insurance. But she doesn't make enough to really afford it. And so actually Medicaid expansion is going to benefit my niece. And so, as the campaign manager, obviously this issue is very deeply personal to me, but I honestly believe that every Oklahoman has a niece or an aunt or an uncle or a mom or a dad that needs access to healthcare. And that's how you start the conversation.
Yeah, actually throwing back to Amy for 1 second, I mean, have you seen, because what Amber was describing is something that rings true in our experience the last 4 years of people having conversations about their nieces and learning their nieces might be someone who would be eligible for Medicaid expansion if not for the politics. Have you seen any changes in the trends in thinking about Medicaid or healthcare generally since we started this work, but also in your research before, because I know you didn't just start this work with us?
Yeah, I think for a lot of people, it is that personal connection to someone who would benefit from this, or the knowledge that they benefited from a program in their past. I almost challenge the assumption that we have to get Oklahomans and Missourians to break out of their partisan shell. I think part of the reason we are so successful is we may come to this, and our friends across the aisle may come to this as a very partisan issue, but I often will ask people in focus groups about issues like this, and we'll ask, do you think Republicans support this, Democrats? And they would say, who wouldn't support this? They don't come to the table thinking this must be a liberal issue. Speaking of attacks that never worked that well against us, this sort of out-of-state liberal billionaires are trying to, make this happen, was also another very weak attack. So I just want to start with that. It's like, people come to this as human beings and thinking about their nieces and not as which party is on which side.
Thank you. And now I want to go to someone who has had a lot of those conversations with voters. Genevieve Williams is a rural organizer, 6th generation Missourian from Newton County. She's been active in politics since she was 15. She's done everything from serving as the vice chair of the state party and on the DNC committee last cycle. She was a critical organizer in the effort to expand Medicaid in Missouri, where we just won about a month ago. And I think a lot has been made of the urban-rural divide. And I think one of the things that really excited me to have Genevieve on this call is that right after the election in Missouri, there were all these folks, frankly, on the left and the right, talking about how rural voters didn't do enough, or we won in the urban areas and we lost the rural, like basically looking at the work in Missouri. And again, the same happened in Oklahoma. I know Amber went through the same thing, almost like applying like the electoral college rules to the statewide ballot initiative and counting counties instead of people. But the county votes actually don't really matter at all in these initiatives. They're just surrogates for clumping people together. So again, Jennifer, a lot has been made of this the urban-rural divide, right? In fact, most of political analysis comes down to the division, right? I mean, that's effectively how many people win. We're seeing it become a absolute strategy for the current administration. That's how they plan on winning, is by being divisive as possible. But we couldn't have won Medicaid expansion in Oklahoma, especially in Missouri, without rural voters, right? There just aren't enough urban voters to put us over the top. So can you talk about your outreach and approach to rural voters and any lessons that we should be learned heading into this fall?
Yeah, absolutely. It was really very much using volunteers in the area to reach out to their own neighbors. There was a point in the campaign where we were even trying to sort our lists and have people from the same area codes call in. We eventually got the campaign, campaigns are pretty large endeavors, so that was a step that we ended up removing because of the complicated nature of just trying to do that. But really, one thing that I would say that we spent a ton of time doing that I think is probably surprising is Zoom training. So like looking back on the campaign, I think that I could say like probably 15% of the time that you're spending with volunteers is training people to get on Zoom and use just exactly the platform we're on right now to learn how to do phone banking in large groups and use auto dialers to be able to reach the most amount of people. And then also text banking was huge. So there were like hundreds of thousands of contacts through the phone and text banking process. But it was specifically about getting folks, like their neighbors, talking to them about it, and also really challenging the messaging that we were seeing coming out of other areas, usually, whether it was targeted at conservative voters or liberal voters traditionally. And again, really using that divide and really trying to split people into groups that a lot of times that same messaging has been used here for a long time. So it's pretty low-hanging fruit, really, but it also gives us an opportunity to be able to kind of meet it head on because we're pretty familiar with it. So I would say that we really leaned on existing connections in the community, whether it was organizers like myself, where I've lived in the same community other than moving to go to school the entire 32 years of my life. And that becomes a major asset when you're trying to organize and reach out into areas. So I would say that those two things were the major push, were volunteer contacts and then specifically focusing on empowering people from the community to do the work, whether it was paid or volunteer.
So I think one of the things that we'll share this out afterwards, but Genevieve did like a wonderful Twitter thread the day after the election, maybe it was the night after the election in Missouri, that sort of breaks this down. But I would love for you to share this moment, like what is, because you're basically making the case that blaming rural voters for not showing up enough was problematic. And I think a lot of us sort of like fall into that, the what's the matter with Missouri or what's the matter with Oklahoma, right?
Mm-hmm.
Like, narrative. And so what's the matter with people who say what's the matter with Missouri rural voters, right? Talk to us a little bit about what are the dangers, the short-term and long-term dangers of that sort of thinking.
Well, absolutely. It's just a factor of like exasperation. I do it too sometimes. Like we all do it. We're like, why is this happening? And it's really just more, again, a factor of like when you hear someone say, like when they're giving up on something, like this is impossible, they don't mean it's impossible. They mean I don't have the tools or the skills necessary to complete this task. And so like when they're saying, okay, I don't understand these voters, is basically the messaging that they're using, like internally, like that's the intent of saying like, I don't get this. But what is coming out is this like admonishment of the voters themselves, which then makes it like so much more difficult for just a passive message to be reaching that person because they feel rejected by it immediately. It also makes it really difficult for me as an organizer to end up doing that work. And I would point to Oklahoma, and not to Amber, but messaging that was coming out right after the election that was very much like, this didn't go well in rural areas. And so for me as an organizer, my county actually, we border Oklahoma. So like this is not like, that, so I was like pouring through the like rural, Northeast Oklahoma counties and like going, oh my gosh, like this is pretty close to the same electorate. What am I going to do? And so you maybe aren't realizing that you're like taking the wind out of the sails of an organizer 15 minutes away when you're talking about like what is wrong with rural Oklahoma voters. So the entire ecosystem is affected by that, because then we're looking through, and I'm spending time looking at the data, like how much trouble are we in? And obviously that was not what I was hired to do, but you become really curious because you're like, what has transpired here? So it really creates a division. It makes it really difficult to then have those like fence post conversations where you're out, getting the mail at the same time as the neighbor or whatever. and they're asking you about the yard sign in your yard, if they're getting a lot of messaging out of, you know, other areas of the country that something is, that they're voting against their own self-interest. That was a common one. And it really kind of annoyed me because when I talk to my neighbors, they're voting in their self-interest of their vote. They believe that Medicaid is going to harm them, and they're voting in their own self-interest. So it's like, you may see, and I'm not saying that that's a widely held belief, but if something's voted, if they're voting against it, it's not like they're going, you know, I intellectually understand that this is going to help me, but I'm angry, so I'm just going to vote. Like, that's not the process that's going on there. And so it's really our job to deflate that messaging and combat it with our own positive messaging, where you're showing, well, hey, this actually is something that is going to benefit, you know, when you start talking to them. Okay, well, the income limit's like 133% of the federal poverty level. You start talking like what Amber was talking about. I also have so many people, their friends and family, that will benefit from Medicaid expansion. So when you start discussing that with your neighbors and they're like, oh yeah, you know, that is true, that does affect me. So you're able to kind of punch through that cloud of left and right, but it makes it a lot more difficult when that messaging is coming out of, even after a win, and then it's underlining, again, the messaging that a lot of time is used by the right and in the legislature, the GOP usually, to try to dismantle those processes or underfund, whatever, which those are not, you know, huge dangers, but that messaging, we don't need to build that foundation for them, I don't think.
And I think you're right. I mean, in our experience, after the win in Utah in 2018 and in Nebraska as well, a lot of what we're hearing from Republicans in the legislature as well, even though the state went for Medicaid expansion, my constituents didn't, or not enough rural people did, or not enough Republicans did. And then they tried to repeal and replace and delay tactics. I mean, it's one of the reasons why we felt it was so important to put Medicaid expansion in the Constitution in Oklahoma and Missouri, because we just can't trust the politicians to listen to their own constituents, as tragic as it is. I mean, Amber, just to you for a second, you have done a lot of work that sort of has crossed the line or has tried to tear off the labels, whether it was teacher organizing or the Medicaid expansion. What sort of messages do rural voters hear, like when sort of these sorts of assumptions are made? How is it debilitating both for the organizers Genevieve described, but also for voters in doing this work?
Well, we were doing work in rural Oklahoma specifically on healthcare and on the teacher walkout, the teacher organizing. Like, it doesn't matter if you live in downtown Oklahoma City or in Medill, Oklahoma. You have a child in school and you want to make certain that school is well funded and that teachers are well paid. And so you start with that specific issue. You don't, you know, it's not a partisan issue. And then the same with healthcare. My dad lives in rural Carter County, borders Texas, and he's a near retiree. And so, you know, he's a likely Trump supporter going into this November. And I had to sit down and have a conversation with him and say, Dad, you know, remember when you retired and when you had to go back to work and drive an hour to Texas to get healthcare? I said, this is what I'm talking about. This specific policy could have helped you. And he was like, I'm sold, whatever I need to do. And then he went and put, you know, 20 signs in his yard and became one of our largest supporters. But I had to sit down and have that difficult conversation. And I had to come to the table with the assumption that every person could be convinced that this was the right thing. Did we win by a huge margin? No. But on election night, the Tulsa World put out a map and it showed that we won 7 counties. And then the Oklahoma Democratic Party actually tweeted out that map and said, this is what voting against your own self-interest looked like. Well, my stepdad is actually a cartographer. So I had him take our data, put it in a new map, and I put another map out that showed complete opposite. It showed that we actually increased support with rural voters, specifically amongst Stitt voters, who is a very, very popular incumbent Republican governor in all but 8 counties. So were we winning rural counties by, you know, 55, 60% of the vote? No, but, you know, we were getting close. We were, you know, in Jefferson County and Moorweeka, where they'd almost lost their hospital. that county went 49%. They got 49% of the vote when they voted, just 2 years ago for the Democratic nominee at like 20% of the vote, right? So it is about increasing that expansion. And so, but if we had just said we can't win rural voters, we're not going to even try. So we're not going to go do any events. We're not going to make any voter contact in those communities. We would have lost on election night. And so did we win those 7 counties? Were they mostly urban? Yes. But we also held our ground in rural, and I would say that rural voters were critical to our win. And if anybody that's on the call or webinar today takes anything away from this panel, it's that you cannot slice and dice your electorate in ballot measures, because you have to build a broad coalition of support amongst voters and organizations to make sure that you have sufficient funds to win and the right support to take it over the finish line. Because if it comes down to partisan politics and you're working in a red state, you're going to lose.
Yeah. And Amber, I'd almost suggest that's true for almost every race except for maybe the president, where you actually are looking at, basically assigning wins based on the electoral college. Any down ballot race, whether it's gubernatorial or even other statewide federal races, we should be counting voters and talking to voters and not counting counties. Amy, you want to add anything to this? And then I want to bring Jocelyn into the conversation.
Yeah, I also just want to underscore in both Oklahoma and Missouri this time, we were in off-year electorates. They, purposefully placed them there to make it that much harder across the state, but especially in rural areas, and to suppress support. And when you look at other states like Idaho, Nebraska, Utah, where we did even better in rural areas. So I don't want people to take the impression from this that like we get close in rural areas, because a lot of times we win a lot of rural areas. So I would take it even a step further in noting that. The other thing I would say, Genevieve brought up this really important thing about self-interest. And that was a big thing that we talked about a lot, is communicating to rural areas just how much this helps keep rural hospitals open. That was a huge part of our argument, keep people employed in healthcare jobs. And I think, that sort of shows you like we do have to give them an answer on the self-interest side and not just assume they agree with us from the jump.
Great, thank you. We could probably talk about this for another 3 or 4 hours. And certainly we're building all this learning into every subsequent campaign as we look to do Medicaid expansion now for 2022. We're talking to folks in Florida, Mississippi, South Dakota, Wyoming. And so with every campaign, we're able to take the lessons from the past, like we hadn't been doing the constitutional amendments in previous states, sometimes because we couldn't, but also because we didn't realize just how much of a threat the legislature could be afterwards. And so I want to bring into the conversation now Jocelyn Strauss. Jocelyn's with Mobilize.us, Mobilize America, and she's an organizer. She's been working on gun violence prevention for 6.5 years, working with Moms Demand Action, and working with Everytown for gun safety. She's a native of Tucson, Arizona, and she brings all of this grassroots experience, working on ballot initiatives, working on building communities to end gun violence, to the work at Mobilize, which is a tool that the Fairness Project has been using for about 2.5 years now with our campaigns. And one of the things we like to do is to ensure that campaigns have the resources they need, the expertise that they need, staff to run like a Senate or gubernatorial race, and also the tools they need so that they're not, and one of those tools we found that would be really valuable is in Mobilize. So, Jocelyn, like as someone who's helped us get better at digital organizing, it's something that has become even more critical during COVID. What are some lessons that you see sort of in the way that we can use tools like Mobilize and SMS and online organizing to be able to communicate with like voters everywhere, but rural voters in particular, and also like as you look through the work that we've done in Oklahoma and Missouri?
Yeah, and just thank you for having me as part of this conversation. I get the pleasure to work with the Fairness Project and got the pleasure to work with Yes on 802 and Healthcare for Missouri. Just a little bit about Mobilize. We're really committed to basically helping organizers do that like tedious work that takes a lot of time and doing it really easily. So you don't have to spend time in front of the computer entering information, all of that kind of stuff. You need to have those important conversations that they're talking about here. So we're really committed to having a platform that allows you to easily recruit your supporters, plug them into meaningful actions and events while increasing their engagement over time. Even in a virtual world. We saw at the beginning of the year, virtual events made up like 10 to 15% of signups on Mobilize. They're 95% now. So we have completely shifted over to a virtual world. And it's amazing to see the creativity, especially in ballot initiatives, how folks are really pivoting and still being able to collect signatures and do that educational work that's so important. We have something we call the network effect here at Mobilize. So you can see this in cross-promotion features where you can partner with other organizations and really easily either share their events or have your events shared. Really meaningful work when you've got to educate and sort of expand your reach. So it really allows you to have kind of like tap into new volunteers just by having events on your platform. We have other features that allow you to kind of expedite and sort of grow that supporter base really easily. One of the most simple but actually really phenomenally helpful is just an automated bring a friend ask. Once you sign up for an event, you get a little pop-up that says bring a friend. We see on the platform roughly 21% of all signups on Mobilize are coming from this bring a friend ask. And notably, Yes on 802 in Oklahoma saw 21% of their signups coming from people taking that link and sharing it with their own personal networks. Healthcare for Missouri saw 16%. So you're getting like a whole bunch of folks just taking that, sharing it out with their personal networks, which is bringing in new supporters, new people into your coalition. We also have features like event suggestions. So you can easily, while you're clicking to bring a friend, you can one-click sign up for additional events. So I'm saying, okay, cool, I want to sign up for this phone bank training. While I'm at it, I'll sign up for some additional phone banks. And we see across the board, 14% of signups are coming from just suggesting additional events. Missouri saw 14% of their signups come from that. So we're seeing a lot of ways that folks are able to kind of expand that reach, expand that coalition, just with a simple use of a tool that you're able to put all your events on one place. It seems simple, but we're really focused on kind of building out these tools and features that help you build and foster and sustain your communities. We're building more as we speak, such as online and digital actions, group chat, to really kind of continue building that community. And especially in a virtual environment, it's really important for people to feel like they are a part of that. I could keep going, but I wanted to mention the distributed organizing, I think, is a really impactful tool that folks can use to really expand their network. So you are able with Mobilize to use a tool that basically lets volunteers host events on behalf of your organization. You templatize it, and there's a whole approval process, so folks aren't just creating events that you aren't sure what they are, but you're able to have a whole approval process that allows you to basically expand your organizers. Organizing in rural areas is sometimes difficult. It's a lot of space in between. So being able to depend on your supporters to bring in their networks, host events for you, just sort of expands the amount of folks that you can bring in. We see actually 48% of all events on Mobilize are done by volunteer hosts, which is really, really impressive. And in roughly 40% of the zip codes across the country, we see the majority of people who are signing up for an event for the first time are coming from volunteer hosts. Hosted events, and they're 2 times more likely to come to another event within a month. So you're pulling in a network, you're pulling in new volunteers, you're basically building up your organizer kind of like game in the rural areas, and people are wanting to do this on behalf of you. And it's really impactful, and we're seeing just through the data that folks really they're building a community, and it's their own community, and they're bringing their own community to your organization and mission.
Yeah, thank you. I think we've seen so many of these tools that were designed in a pre-COVID moment really rising to the challenge, and people are creating all sorts of hacks to make it work in the moment. Right, we're no longer organizing 5,000 person rallies. We're organizing, drive-by parades and such. And I think it's really powerful. I mean, Amber, something that Jocelyn was referring to, right, was sort of like decentralizing control, decentralizing power, empowering volunteers to and this is not new, right? I mean, Obama did it, and it obviously happened before then. But so what is it like as a manager to sort of give up that? What sort of mindset do you need to have? How do you run a team that is comfortable sort of handing the keys to folks around the state to be able to really run their own piece of the campaign?
I think it's a matter of trust and respect for your volunteers, right? So you come to the conversation with the assumption that you trust that they are working on your behalf, and so they're just an extension of your team, and you have to treat them that way. We had a super volunteer in Stillwater that was running a postcard writing machine, essentially. Like we couldn't print the postcards fast enough. But it's, we started early building that relationship and trust. And then, it was something that you have to sit down with your team and say, look, this is going to happen. We're going to allow our volunteers to do events. But if you don't have that trust and respect of your volunteers and really treat them as an extension of your own campaign team, it's not going to work. And I think oftentimes campaigns find themselves siloed. And the campaign manager oftentimes is just overwhelmed with having to do this, this work that could be done by volunteers who want to help. Volunteers want to help. You have to trust them and respect them so that they have access to the tools that you do. And train them. You have to make certain that you're taking time to train them to use the tools. Just like Genevieve, we used a lot of Zoom trainings to do our Get Out the Vote, contactless, GOTV. We were doing house parties, and we had toolkits that we would put online to teach people how to walk through, how to host your own house party, how to host your own Zoom happy hour, healthcare happy hour. But thinking about this as offering, continued education for your volunteers is really a great value add to volunteers, because politics has become very transactional, and it really shouldn't be just a transaction of this is what I need, will you go do it? But this is what you are going to get out of this experience with State Question 802. If you are willing to put in, the sweat equity, then we are going to give you the training and the tools you need to be successful, not just in 802, but in other campaigns in the future. So it's about infrastructure building, and ballot measures are a great way to infrastructure build for other issues and candidates that you're thinking about, down the road.
So, one of the things that we heard I think everyone speak to comes to, I'm just jumping into the questions here. So if folks have more questions, there's a Q&A button at the bottom. Please type your questions in there, and we'll try to get to as many as possible. I also see some in chat, so I'm gonna try to manage them all. Kyle wants to know, he writes, I've heard a few times in the panel's answers, it's important suspending judgment or assumptions that the voters come to these issues from a partisan perspective, as they often do not. And he said he had an aha moment, and he asks, how hard is it to keep the volunteers to that mindset? How do you do that? How do you see volunteers from both parties? I don't know, Genevieve, you want to start there?
Sorry about that. I had myself muted 2 places, just to be sure. Anyway, I would say that it starts really with like the culture with the paid organizing staff of like making sure that you're trained appropriately and in the right way. But I remember a few different actually phone banks that we were running on Zoom, and where we would have some of the volunteers like express some exasperation in the chat, and then we would kind of have somebody discuss with them like, hey, completely reasonable, because it is frustrating work, and especially when you're doing individual voter contacts and they're like, please leave me alone, is probably the nicest thing you get if they don't want to talk to you. It's completely understandable. So again, you're not villainizing, you know, the volunteer for having that like moment of weakness where you're just like, oh my gosh, I can't take this anymore. But then, you know, you pull them aside and talk to them and be like, you know, discuss that, yeah, it's frustrating work, and exactly what Amy was talking about. It's not actually voting. I mean, when you say, oh, they're voting against their own self-interest, you're underlining and bolstering the argument that this isn't in rural American self-interest to have access to rural hospitals and, you know, healthcare, because that's, of course, we all understand that, you know, your length of ambulance ride with a lot of things can have a major outcome on a major make a difference in your health outcome, and like can be life or death. So I think talking about stuff like that, not really fear mongering, but it's just the reality of it. And if your hospital is 40 minutes away, it's very different than if it's 20. So yeah, I would say that's kind of the main point to drive home is just to humanize each other. And of course, there were like points where we were getting a lot of racist messaging coming out of the No on 2 campaign. There was at one point a mailer that had the Mexican flag over like a COVID mask, like a mask that we're all using as PPE lately, and talking about like illegals are going to get health care or something. You know, it was like very, very racially charged, very insensitive messaging. So we're then like combating that directly in, you know, making those phone calls and making those contacts. So like just not allowing it to go unchallenged, I think, is a huge thing. Like, this is in your self-interest, and that is, you know, racially charged messaging that's intended to like get you as a low information voter, because I guess they're assuming that you're just low information and fear based. So when you have those conversations, they're like, oh, you know, that's a good point.
Yeah, and actually, something you're telling of that story about the really racist mailer that went out, I think sort of answers a question Alexandra Johnson asked about how is the divide used, and they literally went. One of the I think a pride point in winning in Missouri was that it was not just winning Medicaid expansion and putting the Constitution, but it was a rejection of some pretty grotesque racist messaging that we are going to see certainly a lot more of in the next few months. And we'll probably see next week. And so it was a renunciation of that as well. And if folks want to see more about the tactics used by the opposition, it's all online. It's easily found. And then just also, Alexandra, I think you asked a great question about what efforts do we make to reach rural Latinx voters, African American voters. I think one of the things that we try to emphasize in all of our campaigns is that they're like to break with this notion that like Latinx voters and African American voters, Black voters are urban voters and rural voters are all white. And so we just come into that with sort of breaking without even making that assumption, because we think it's dangerous and it's wrong. Second is we build coalitions. I think one of the key pieces in what we do is from the very beginning, we ask ourselves, this is the work Amy does, is the initiative viable, right? So can we get 50+1? But then we also ask, like, is there an enthusiastic coalition on the ground that represents the community? So it was critical in working in Oklahoma and Missouri that we had the tribal nations like supporting this work from the very beginning, and you know they invested hundreds of thousands and millions of dollars into this work, or working with local Black and Latinx groups to both give them as much as we could, give them the tools that we were giving to everyone else. And so I think like early outreach, building a coalition, ensuring that the locus of power does not exist in just Amber or the Fairness Project, but actually in the groups that are doing the actual organizing work. And so I don't know if that quite answers your question. That is, and frankly, we could always do a better job of it. Like, it's not something that we've solved. We have a lot of work to do. And Jocelyn, just to jump to you for a second, and we're sort of running out of time, so I ask everyone to either be brief or talk as quickly as someone from New Jersey like myself. Like, how do coalitions exist virtually, and how do you leverage either Mobilize or any tools online to think about building and sustaining coalitions?
Well, I think a lot of folks have actually touched on it. Being able to empower your supporters and training is huge. And we saw the hard pivot to virtual life and organizing really was focused in on training. At Mobilize, we have the cross promotion feature, which allows you to really work together. I like to think of it as like building almost like an ecosystem for coalition building, because you can easily share your partner organization's events, they can share your events. But what we see broadly is really training volunteers and, again, empowering them to lead for you and organize for you, not just do an action. Actions are not enough for volunteers. They really want to volunteer with you. And when a campaign ends, they're going to keep volunteering. So if you're training them with the skills here and now, they're going to take those skills to another campaign or another mission, hopefully keep going into 2021, where I have a sneaking suspicion there's going to be a lot of battles fought in state legislatures. So giving them the skills now is going to continue to just build an entire movement and ecosystem.
Thank you. So with a few minutes left, I'm going to try to combine some of these questions. So Yoav is asking, he would like to hear more about countering racist messaging. He writes, my candidate is an immigrant with a thick accent in Wyoming, the reddest state in the union. So I think he's probably concerned about countering racist assumptions about him and messaging and attacks. And then similarly, Nate Lerner is asking, he's running digital ads for 2 congressional candidates in red districts. What strategies and messaging would you recommend to use in short 15 to 30-second ads? It's extremely difficult to explain why these issues should matter to all voters in such a short ad. So I don't know, maybe Amber, we can jump to you to talk maybe a little bit about how do you communicate in short bursts these values, and Amy, I don't know if you might have some in your work.
Yeah, we actually had a great digital vendor with Hamburger Gibson, but we actually took 6-second and 15-second clips of real people in rural Oklahoma that we got when we were going out on our 21 city tour. We would have an iPhone. We actually invested in putting a videographer on that trip with us, and we got a lot of great footage, and we were using those. So using messengers from that community to talk about why it was important. Specifically, we used rural hospital CEOs, or we used a local insurance agent in a Western Oklahoma town. So it was really about using validators from those communities with very short, this is why I'm voting yes on 802. And it was very effective.
Wonderful, thank you. Amy, anything you want to add to
that? Just, and this is hopefully obvious, but you know, we're progressives. We love to talk about facts and policy and things like that. And in the earlier states, I spent a fair bit of time sort of talking advocates away from talking about the Medicaid coverage gap and donut holes and things like that. And you really just, you want to boil it down to values. Should someone who, you know, is trying to put food on their table for their kids at $15,000 a year, should they have health care? And not get into the sort of the policy wonk, and just always check yourself on that language.
So jumping to another question.
I'd like to jump in just like really quickly. I know that you didn't, but I do want to say something from Missouri really quickly. I have a long background in like more Democratic campaign related politics. Usually we had always like kind of pivoted around any kind of racist messaging in rural America, like rural meaning in this instance specifically like rural and white voters. And I was always used to like trying to avoid it. I mean, not because I wanted to, but because I didn't have any skills or tools or training to be able to address it directly. So this was the first campaign that I ever worked on that we really did meet that with anti-racist messaging and talk a lot about like the kind of like wealthy white elites are using this messaging to divide poor white people and poor brown people and poor black people and all of this, and drawing that in and saying like these you have more in common, like, and then when you're having that conversation, this is being used also kind of as an insult to your intellect, this racist messaging, that they're not meeting you with facts and data. But I was used to like kind of countering the racist messaging with facts and data, and it's never worked the whole 17 years I'd been doing it before this. But you know, like, so yeah, I would say my greatest truth that became evident that I learned on this campaign was to meet it directly and talk about the fact that like wealthy white people are using this and have used this since the very beginning of our country to make the rest of us either get out of the way or do what they want.
Wonderful. Well, I think that's a great place to end this. I want to thank Genevieve, Amber, Amy, Jocelyn, and I'm sorry to those whose questions I didn't get to. Feel free to write in to the Fairness Project, and we'll try to get you answers for all your questions from any of the panelists. I also really want to thank our sponsors, Benison Strategy Group and Nossaman LLC, who are partners in this work and really made this panel possible. And also want to thank the Fairness Project team, Aubrey, Barbara, Rachel, for helping to put all this together and getting the technical stuff right, because that's often the biggest obstacle to having great conversations. So thank you for that, and thank you everyone who joined us today. In the chat, there's a link to sign up for more about our work. The Fairness Project we won 18 out of 19 campaigns, and we're frankly just getting started. We're already planning, we're already looking at 11 campaigns for 2022, and in each one of these, we're asking ourselves, how do we have the greatest impact in the lives of working people, working families, and regardless of who's in the White House and the Senate and the House come 2022, we know that we're going to have to keep fighting for working people at the local level, especially in red states. And so I think the one thing we didn't really get to today is sort of like, what do we do with all this? What happens after the ballot initiative? What happens after we win Medicaid expansion in these states? And I'm not going to put words in anyone's mouth, but I think one of the most important lessons that I've seen in talking to folks in all the states we work is that we need to build really long runways for whatever wins we want to have. So if we want to win Medicaid expansion, we have to start working easily 2 years out in these states to build strong coalitions of support, to find the resources, to talk to voters, to animate and excite people, to do the right research. And the tail is true too, right? We need to continue to invest in implementation and also to invest in what's next, and to not sort of unplug and go from ballot to ballot, but really take the expertise of folks like Amber and Genevieve and Jocelyn and Amy and reinvest them in what's next. And so I think as folks are thinking about where they want to put their energies, like I would invite you to join us at the Fairness Project and join these incredible organizers and leaders in not just the states that fall on the important map when it comes to presidential politics, but I think looking at the whole country as being valuable, and every American is worth investing time and energy in. So thank you so much for joining us. Have a wonderful day, especially at this early hour. Take care.
Thank you, Fairness Project.